Hi guys, I'm Dr. Anne. Welcome back to my channel. So today I'll be talking about experiencing death as an intern because that's the first real death that is basically life that you'll experience as a doctor. So I'll be talking about that, and also watch out for the third part where I go through the death series, which is the final part where I go through basically death that you experience now as a medical officer, or will experience as a medical officer when you already now have all the responsibility. Because as an intern, you're like a junior doctor, no one cares, everyone forgives you because you're still learning. But as a medical officer, it's real. So basically, as an intern, the second death that you'll experience as a doctor, or we experience as doctors, is a bit traumatic in a way, in as much as an intern, technically, because you are still learning, you are under the supervision of medical officers or your seniors, be it registrars, medical officers, and whatnot. I think this is the worst type of death because, in a way, as a doctor, the reason why we did medicine was to save lives. And somehow we all have the perception that we're gonna save lives. And that happens, but not all the time. You know, sometimes people die, and that's just the reality of the situation, that you won't save all lives. And that whole reality slaps you like a mother. Like, no one can prepare you for that. First and foremost, I will start with the technicalities or the technical parts before I get to the story time and things that I experienced as an intern. There's specialties where people die. Like, when I say die, I mean die. People die, guys. Medicine, internal medicine, people die. Like, it's just a shocker. And you think you're saving lives until you rotate through internal medicine. And just that rate of people who actually die is just incredible. Because I think it's actually because people in medicine or the medical wards are actually generally like sick people. Whereas in surgery, it's someone who probably is not that sick. The part you can cut it out, throw it over there, person recovers from the operation, and they are back to normal. In ONG, they come in, they deliver, they go back home. It's not people actually sick. So that's why in other specialties, you won't really experience death like that until internal med. Like internal med, you can get called, like, I'm talking about regional hospital. I can literally only imagine what happens in like big hospitals. So I was an intern. I worked at Far East Rand Hospital. In this case, they called me for a patient who they found had passed away in the ward. And it was a patient who had prostate cancer. And so I was just like, oh, okay. And it's my first time. It's literally my second week as an intern. At this point, I'm like, okay, sister, I'm coming. I get up. First of all, that walk is creepy to begin with. Like, I'm just walking, it's dark, like, creepy. I'm just like, oh my gosh, I've never seen a dead person in my life. Literally, I was like, oh my gosh, I've never seen a dead person in my life. Like, what do I do? What do I write? So I get to the ward, and obviously I have my stethoscope. I have to look legit. I go in, I'm like, hi, sister. They're like, yeah, he's there, like, behind the curtain. So they literally closed it up. I'm just like, and you know how sisters sometimes will switch off some of the lights in the different cubicles. Now, this is creepy. Like, if you are someone who watches horror movies, like, you'll find anything creepy. I found it creepy. I watch a lot of horror movies, even though I'm not spooked out, but I'm just like, oh, I'm a bit scared. I'm a bit scared if I do say so myself. So I'm just like, okay, whatever. Let me go in. You know, I don't have a choice. I don't have a choice. Send it up. Low life that I picked for myself, unprovoked. And so I check for pulses. I'm just like, oh, there's nothing. And I think he had passed away like a while ago, because his body was already in rigor mortis. Like, it was already a bit stiffish. And it's just like, when it's already like when it's a fresh body that's still warm, it's a bit better because it's like a human being. Like, not like a human being, but you know what I mean. Like, it still feels like a person. So the sisters will normally, call the family to inform them that the person has died. Sometimes the family will want to see the doctor because obviously, like, they're looking for someone to blame always. That's just human nature. I don't know. Or they're just looking for explanations, especially if the person hadn't been sick for a long time. They will literally be like, oh, can we see the doctor? And as an intern, you appear and they just don't take you seriously because they see a young girl, and you have to sort of like explain to them. And that's when you have to literally have the balls and the confidence to be like, okay, this person was sick, or cancer, stage 4 cancer, and what was currently being done, I don't know if it was explained to you, it's palliative care to try to make the person comfortable, so that they basically die comfortably and are in a comfortable setting and don't feel any pain before they actually die. But it's a terminal illness and blah, blah, blah. So those are the things that you will most likely have to explain to families. pertaining to death, sometimes sometimes they will not be satisfied. Sometimes families are generally not satisfied. I know when I was in casualty at some point, sometimes it was advised that we call the family during the resuscitation. So especially, resus patients are normally patients who are young, or maybe patients who aren't really sick, coming with an acute illness, and you have to resuscitate, try to get them back to life. So in such cases, when we see that, hey, it's the person's about to die, we call the family and be like, so that they're able to see us doing actively resuscitating, chest compressions, blah blah blah, so that they see that an effort was put in to try to save their family or their family member's life. So that was also something that was found to contribute in their sort of satisfaction, because obviously, I mean, human nature, we're always looking for someone to blame or something. Someone will be like, but Dr. Benzanga enough or whatnot. But when families actively see you resuscitating, normally there's no questions done. They see that you try to do the most and whatnot. It's important to document. That's the most important thing. Everything needs to be documented for medical legal purposes, because people are trying to sue. Like, people are out here trying to make money, and lawyers don't sleep. Lawyers know medicine more than us. Like, lawyers are out there making a living off of doctors. And the unfortunate thing is that Nati, obviously, with the public sector, there's equipment that are not working. Document to cover yourself, because go rough out here, go rough, like I already mentioned, it's rough. So that's the other thing that you have to look out for. Even though as an intern, still you're under someone's supervision, but still it's important to learn that skill of having to document, just so that you have everyone covered, or yourselves covered at least. Yeah. So that is the case. So as an intern, I mean, nice life problems, really, you don't really have to go through much. You don't really suffer that much. No one will ever blame you. I mean, no one can ever get used to death. I don't care who it is. You can never, ever, ever get used to people dying, because the assignment yakho to begin with is to save lives. And the unfortunate thing that we come into realization only after, or only later in our career when we've started working, is that not all lives, get saved. And that's the reality of the situation. Not everyone survives. Sometimes you try all your best, sometimes you defibrillate, and still someone doesn't survive. Sometimes you think, okay, you've succeeded, and they just die in the ward. All we can do, and we have to learn to do, is to play our part and try not get involved. Even though obviously you can only go so far, you are not in charge of life. You are not a giver of life. The one person that is in charge of all of that, and unfortunately it's something that we realize later on, is that it is God. And all we do is just instruments to try to salvage the situation and whatnot. But when God has decided, like, that this is where this life ends, even if you go through all the steps, even if you give them all the drugs, the person ends up dying anyway, because they were meant to die. It was just how it was meant to be. And that's just the unfortunate thing about life that we have to accept. So I hope you learned something. And also stay tuned for the third part of this video series of death and medicine. The third part, where I'll be going through basically death that you are facing as a medical officer, now that you are the one who is responsible and will have to answer. You have to answer for deaths of patients and things like that, because there's more responsibility that's tied to the job title. So stay tuned. I hope you enjoyed and are enjoying and are learning something. For the people who've always been wondering, thinking doctors are machines and robots, and how they deal with death, also stay tuned. You are 100% welcome. Thanks for watching. Make sure you like, comment, subscribe, and then I will catch you on the third video.